Hi. Session 11 writing task is to write a letter requesting assistance for a pregnant lady, Miss Amy Wynyard, who is a drug abuser, smoker, and a drinker. Now she is concerned about her pregnancy, so she was self-admitted to the hospital to seek help. Here, Miss Amy Wynyard is a patient in your care at the St. Kilda Women's Refugee Center, and the letter is written to Miss Lucy, a registered nurse at Community Health Center, St. Kilda, requesting ongoing care and assistance throughout her pregnancy. Let us look into the case note first. If we look into the case note in detail, we can see that she is pregnant with her first child and came to the refugee center a couple of days ago requesting help for her substance abuse problems. She wishes to cease her alcohol consumption and drug use. Here there are two dates given, that is the admission date and the discharge date. Here the admission date is irrelevant and not to be mentioned in the letter. And since the letter is written before the discharge, you can use the current date as the date of the letter. The details of the patient given are Miss Amy Wynyard, age 21, where the name and age are important and should be mentioned in the reference. We can see that almost all the points mentioned in the case note are important and should be mentioned in the letter except some information like no pain in hips or joints, no decrease in appetite, no double vision, and the patient wished to continue to live with a friend on her sofa. Excluding this, all other information has to be included in the letter, and that too in an organized way. The reason for emphasizing this point is because in the case note we can see that the information provided is not in an organized manner, and there is a possibility that the writer will be doing the same while framing the letter. In the reasons for the admission, the way in which the information provided are by small points. So there is a chance that the writer frames a paragraph using simple sentences which scores less in OET writing. Even though the case note shows simple points, the writer should merge two or more points into a single sentence to construct a complex compound or compound complex sentences. The same goes with the lifestyle part. Here, the writer can join the information which has a common factor. In this case, the age of the patient. Here, at the age of 16, she started drinking and used drugs. Using complex or compound sentences in your letter can get you good scores. Taking all these points, we have to prepare the letter. Now, let us see how we can write a letter with the help of a sample letter written by a candidate from India. The address and date written are correct. However, whenever you write the date, you must use two-digit format. The salutation written is wrong here. Miss Lucy is two words, so you must put a space between Miss and Lucy. And also, the first letter of the name should be capital, and a comma should be placed after the name, which is missing here. Moving to the reference, the writer could have written it better. Here, again the candidate has used small letter M and V for Miss and Wynyard respectively, which is a big mistake. Also, we don't have to write aged 21 years. Instead, you can simply write 21 years. So, we can rewrite the reference as RE, then place a colon and write Miss Wynyard, 21 years. This is a correct way to write a reference. Moving to the introduction paragraph, I am writing this letter to request ongoing care and support for Miss Wynyard, who is 6 weeks pregnant and has substance abuse. Here the introduction is too short and doesn't deliver a clear idea about the kind of service to be provided. Also, you don't have to write this letter because the person who writes and the person who reads know that this is a letter, and therefore we can avoid using this kind of phrase. Therefore, the introduction can be rewritten as I am writing to request assistance and care for Miss Wynyard, a 6 weeks pregnant lady who wished to cease her substance abuse, which is more impressive and provides more clarity. Moving to the second paragraph, during admission, Miss Wynyard reported pain in lower back, tingling sensation in feet, difficulty sleeping due to worry, depression and hallucinations. She underwent blood tests for HIV and STD and was given counseling of its risk and also for nutrition and pregnancy. She had discussion on possibility of rehabilitation clinic for driving out. Here, the candidate has attempted to conglomerate the relevant ideas but not up to the mark. Her lifestyle mentioned in the case note is not mentioned in this paragraph, along with the information regarding her voluntary admission to the hospital. Hence, the reader wouldn't get any kind of idea regarding those. Therefore, the paragraph can be written as Miss Vineyard was voluntarily admitted to the hospital following her pregnancy confirmation. She was concerned about her pregnancy due to her drug abuse, alcoholism, and smoking. She reported lower back pain, tingling sensation in feet, and difficulty in sleeping due to worry, depression, and hallucination. She was screened for blood test for HIV and STD and was counseled about its risk. She was educated about the importance of nutrition during pregnancy and discussed about the possibility of rehabilitation clinic for driving out. This is how a paragraph should be, which give much impression and idea for the reader. Moving to the third paragraph, Miss Vineyard lives with her friends and has no contact with her parents. At the age of 15, she started smoking, drinking alcohol, and injecting drugs by sharing infected equipments. She had suicidal thoughts and harmed herself. She has a history of depression. Here again, this paragraph contains valid information but not up to the mark. First sentence is okay and is up to the mark, but the second sentence can be reconstructed as she started smoking, drinking alcohol, and injecting drugs by sharing infected equipments since the age of 15 years, which is much better. Then you can say she has a history of self-harm attempts and depression but never consulted a psychiatrist, where the point she never consulted a psychiatrist is given in the case note but did not mention in the letter. So again, a valid information is missing from the letter. Moving to the fourth paragraph, she need maternal health clinic appointment and ultrasound on her first trimester at 2 weeks. Here, the sentence starts with a pronoun and instead, we must use the name of the patient and the word need should be replaced with requires. The rest of the paragraph reads, she requires psychiatric support for depression and community mental health nursing for minimum 2 weeks daily. Minimum 2 weeks daily. She need to attend methadone program and Alcoholics Anonymous meeting. Here, the last sentence can be rearranged in such a way that please arrange a methadone program and Alcoholics Anonymous meeting for her, which is more impressive. Again, this paragraph missed out a few things such as she wished to cease her drug abuse and alcoholism but did not exhibit any inclination to quit smoking. And you should have added that in this letter. The next paragraph says, it would be greatly appreciated if you could provide ongoing care throughout her pregnancy, which is perfect, but you could have added the name of the patient in the sentence as well since it is a separate sentence. Coming to the wind-up sentence, you have to mention the name of the patient along with the sentence. Then it becomes, please contact me if you have any queries regarding Miss Vineyard. The sign of yours sincerely, which is wrong because the writer used your instead of yours. It should be yours sincerely and it should be charged instead of charged for charged nurse. This letter would fall on a score of 260. Thank you.
New method for OET learning. How are you preparing? Online or offline? For speaking and writing, you can get tutor reviews. How will you be able to manage your reading and listening? How can you manage your self-practice easier than never before? Learn OET in Merlin's way. Most successful OET learning method from world's best online trainer. Chat now. mentormerlinexam.com